Hello, everybody. My name is Gabby Field, and today I'm going to talk about gender bias and the relation to underdiagnosing in healthcare. So, to begin, here are some key definitions. They're kind of simple and kind of basic, but I thought I would get everybody on the same page. So, gender biases is an inclination of temperament or outlook, a personal and sometimes unreasoned judgment or prejudice, particularly against women for the gender biases. Underdiagnose means to diagnose a condition or disease less often than it is actually present. And then what is the relationship between gender biases and underdiagnosing? This would be when a patient is underdiagnosed with a disease due to the gender biases from healthcare professionals. So typically women being underdiagnosed because a healthcare professional has either a subconscious or a conscious bias against women. So, what are some consequences of the gender bias and underdiagnosing? Well, there's delayed treatment. There's also inaccurate medical research because of this. Sometimes patients, when they are not accurately diagnosed with their disease, have an increase in pain and suffering. There's also higher healthcare costs associated with women's products or treatments. Things like tampons are obviously very expensive and other more medical treatments, surgeries, things like that. The prices have been raised significantly compared to surgeries that are typically for men. And so there's some gender bias in that as well. And then mental health impacts as well. Whenever, a patient will have really high pain and it's lasting for a very long time, decades, they will definitely have mental health impacts. The higher healthcare costs could lead to the inability to get treatment. That could also lead to some type of mental health impact. So that's also a big factor as well. So here I have a timeline of the women's health history. First, in 1946, I think it's very important to first mention that this is when women began to outnumber men in the United States. And so keep in mind, as I'm listing all of these different events that occurred in the past several decades, that women are outnumbering men during all of this. And so you would think that for the population that represents most of the American population, there would be research and studies and healthcare that is accessible and fair to them. However, it is not. So in 1977, the FDA excludes women of childbearing age from phase one and phase two trials. This was because there were fears from thalidomide pills being used in other countries like Australia. And this was a sedative that was used for morning sickness for women. However, it was not like completely researched before this drug reached the market for this purpose, and it was actually causing birth defects in children. So the FDA specifically excluded women from these phase one and phase two trials to try to prevent the birth defects happening in children due to unknown effects of drugs. However, this was one of the biggest reasons why women were not researched on in the late portion of the 20th century because they were not allowed to be researched on and things like that. So keep that in mind. They maybe had good intentions trying to keep the babies as healthy as possible and women of childbearing age from developing infertility issues. However, women who were wanting to be involved in research and wanted their studies and their medicine and their healthcare to accurately reflect them were denied those opportunities. The Office of Research of Women's Health Research was established by the NIH in 1990. In 1993, the NIH Revitalization Act was put in place. This was the first major U.S. policy that actually required women to be included in federally funded clinical research in numbers proportional to disease prevalence. So there was about 20 years, give or take, that the women were not allowed to be in clinical trials. However, in 1993, now they were required to be in the clinical trials by the NIH. In 1994, the FDA established the Office of Women's Health. In 1998, it was made a law that new drug applications must present safety and effectiveness by gender, age, and race. In 2001 and 2010, they NIH or the Institute of Medicine released two studies that highlighted gaps in the understanding in sex-based differences. I put this here because I wanted to show that research was being published actively in 2001 and 2010, explaining that there were gaps in gender biases in healthcare and research and things like that. However, it wasn't until 2014 that action was actually taken because of these studies, and other research was also being published. And it wasn't until 2014 that action was taken. So in 2014, the NIH leaders, Dr. Janine Clayton and Dr. Francis Collins, implemented a policy mandating that researchers consider sex as a biological variable in both animal and human studies. In 2016, the NIH mandated that preclinical studies must include both sexes. It wasn't until a decade ago, 10 years ago, that women were required to be in NIH preclinical studies. In 2020, so just 5 years ago, the women's health research accounted for only 10.8% of the NIH budget, which continues to show ongoing disparities in funding for research for women. This was only 5 years ago. In 2021, the NIH began a program called Advancing the Health of Women, identifying research gaps in female-specific and sex-influenced diseases. And then just last year in 2024, the White House launched an initiative on women's health research. And along with that, the ARPAH committed $100 million to transformative reproductive and delivery research as well as women's health research. So we finally started to get some advancement, but it was just last year that this type of advancement and funding and budgeting was implemented. And again, keep in mind that first point I mentioned that during all of these things, women are outnumbering men in the United States in terms of population, and yet they are still the most underrepresented gender in healthcare, and that is pretty insane to me personally. So, some counter arguments that people will have against gender biases, they'll argue first that men also face misdiagnosis, so it's not a gender issue. Technically, yes, this is true. However, women are disproportionately told their symptoms are psychosomatic or hormonal, especially in cases like endometriosis, which I will focus on in a case study in my survey later. Heart disease, chronic pain, and other diseases as well. They are constantly being underdiagnosed because of this. So, yes, men do face some underdiagnosing, and it is just a fact of healthcare. There are going to be diagnoses that are missed. However, keep in mind that women are disproportionately told their symptoms are something completely different and they're underdiagnosed. And keep in mind all of those dates that I just mentioned in the previous slide of lack of research, lack of education, and different things happening in medicine. Some people will argue that since more women than men are doctors now, the system can't be biased. However, as you saw in the last slide, medical education, research design, and guidelines still largely reflect a male norm, and gender bias is a systemic issue. So it's not just about the individual doctor's identity and if whether or not they're biased. Even if you do have an unbiased doctor, you will still face these gender biases in healthcare because it's such a widespread systemic issue. People will also argue that, well, now we include women in studies, so the issue's been fixed. Well, as you saw on the last slide, even in the past 5 years, there are still changes still being made to help close the gaps between men and women's health. And many studies still don't analyze results by sex, or they don't include enough women to draw valid conclusions. And it's also interesting to note that all the older drugs that were released and approved prior to women being required to be in studies haven't had sex specific like dosing guidelines gone back and re-examined. And if they have, they probably weren't necessarily um, like including enough women to draw those valid conclusions or analyzing the results as well as it should have been. So some of these drugs that are still on the market do not have women's research to see how it affects their hormones and other things that are different between men and women. Some current issues in medical misdiagnosis, reproductive health. So I'm focusing on reproductive health. Endometriosis is currently called as a missed disease. This is because on average, it takes about a decade for endometriosis to actually be diagnosed because most primary care physicians will just diagnose with something like irritable bowel syndrome or chalk it up to just normal period cramps, things like that. And so women are not being diagnosed for so long that it's actually called a missed disease. And I think this is interesting because there's been lots of publicity recently to the underdiagnosing of endometriosis. However, it is still considered a missed disease. Adenomyosis is also underdiagnosed. I pulled this quote from an NIH article. It says that the prevalence of hysterectomies is between 5% to 70% that are caused by adenomyosis. So basically, of all of the hysterectomies, 5% to 70% will be caused by adenomyosis. That statistic is basically irrelevant because 5% to 70%, you might as well just say some of the hysterectomies will result from this because that statistic is insane. That's such a wide gap. Going off of that, polycystic ovary syndrome, or PCOS, the World Health Organization reports that up to 70% of the affected women remain undiagnosed worldwide. I think this is really insane considering how common PCOS honestly is. I think it's also important to note that PCOS is common in people of color. And so maybe there's also some racial biases that are going into this as well. But either way, both the gender and racial bias needs to be rectified. So this is my case study. It is about Lexi Frankel, who has endometriosis, and this was an autobiographical article written by herself so that she could bring light to her experience and help raise awareness for other people. So at age 15, she began experiencing some severe pelvic pain, especially during her menstruation cycle. Her doctor told her that the pain was normal and to just take ibuprofen and use heating pads to alleviate the pain. At 19, it was recommended for her to take some oral contraceptives to help alleviate some of these symptoms, and it did mask the problem, but it didn't solve her condition. It also was causing her some really intense migraines, so she basically traded one form of pain for another form of pain, and she ended up going off of the oral contraceptives because of her migraines. Between ages 20 and 23, her pain became more chronic and debilitating, and it was not just during menstruation anymore. This was happening all month long. And by 20, she noted how she had seen three pediatricians, a hematologist oncologist, a gastroenterologist, a primary care physician, and four OBGYNs for her issues. So by 20, she had seen several doctors and they had still not been able to come to a conclusive diagnosis. Between her in her early 20s, she had the nausea, the fatigue, bowel and urinary issues, and anxiety. In her article, this quote came from her article. She said in 2014, she had an episode of syncope, which led to seek further evaluation. She had iron deficiency anemia with a hemoglobin of 8, and so she was started on oral iron. She was tested for a panel of bleeding disorders, all of which were negative. In 2016, she became suspicious of whether she had endometriosis, so she saw two OBGYNs for evaluation, both of whom agreed the diagnosis was highly unlikely and the diagnostic laparoscopy would not be indicated, which is how you diagnose endometriosis. So at age 24, it was when she finally had her endometriosis diagnosis acknowledged. This quote that I have down below, I'm going to read it as well. I think this quote is really interesting. It's kind of long, but every single sentence just continued to shock me. So that's why I included it. So she basically went to a primary care physician for her pain again, and she said that after she was dismissed for just menstruation cramps, she said that shortly thereafter a lower abdominal mass became palpable, and I sought evaluation by a primary care physician who diagnosed me with irritable bowel syndrome and prescribed peppermint oil. I saw a gastroenterologist a few days later who ordered a pelvic ultrasound as he presumed her symptoms were more gynecological rather than gastrointestinal. The pelvic ultrasound showed complex cystic masses on both ovaries, and follow-up suggested to rule out neoplasm. She was subsequently seen by an OB-GYN and underwent exploratory laparoscopy and cystectomy of bilateral endometriomas and was diagnosed with stage 4 endometriosis. Endometriotic tissue was found on the anterior abdominal wall, bilateral ovaries, vaginal wall, appendix, bladder, bowel, rectum, and diaphragm. For all of those things, she was prescribed peppermint oil. I think it's also really pertinent to include that during all of this at 24, she was a medical student. So the only reason she really began advocating for herself was because she knew the symptoms and she was learning about this condition in her education. And she was pretty confident that she had endometriosis. So for a patient who is not going through medical school and is not being educated on what the symptoms look like, it'll probably be an even longer process because they don't know to advocate for themselves. She did receive appropriate treatment post-surgery, including hormonal therapy and pain management. So she did get it taken care of. However, it took her a decade to get her symptoms acknowledged and treated. And if you go back and you remember the anemia tests and different things like that, two OB-GYNs who agreed that they did not need a test for endometriosis, if all of this stuff, if they hadn't just dismissed her symptoms, they hadn't dismissed her physically telling them, like, I am in pain, I have issues, and it is not IBS, it is not anemia. If they hadn't dismissed her, maybe they could have caught it, and she wouldn't have needed all of the surgery. She also had to have an appendectomy and other surgeries to remove the tissues from pretty much everywhere in her lower abdomen area. So, pretty intense. If doctors would have listened to her, she wouldn't have had these symptoms. So I also did a survey. I asked 16 people 7 questions. The ages ranged from 18 to 25 to 46 to 55. And there was one more age range of 36 to 45 in between where I had a participant in that age range. So yeah, 13 people were between 18 and 25, one person between 36 and 45, and two people between 46 and 55. I first asked, do you believe gender bias exists in the healthcare system? And to rank it on a scale of 1 to 5 from not at all to most certainly. So you can see that most of the responses are right around 4 on the most certainly side. There are still some responses over on the lower end at 1 and 2, which indicates that education and research still needs to be published, still needs to be broadcasted. People still need to be educated on this issue so that change can really be made. I then asked, to what extent do you believe medical education, such as how doctors, nurses, etc., are trained, and if it's influenced by gender bias? This means, medical school, nursing school, PA school, physical therapy school, all the different types of education, if people believe that there is some gender bias. 6 people agreed, and 3 kind of in the middle, and 6 people at 4. One person believed most certainly, and 2 people believe not at all. This again just shows that there needs to be more publicity to this issue. People are not aware of the fact that it was just last year when some of these laws and stuff were still continuing and funding was still being given to women's health. I asked, to what extent do you believe medical research has historically been biased against women? So you can see on this end, most everybody was above a 3. Actually, everybody was above a 3 or above. So this does indicate that people are aware of this issue. And so people are aware of it. Why is this not changing? People are upset about it. People are talking about it. People are obviously publishing research as the NIH has done, different things like that, showing the gaps and the disparities, but why is change not being taken? So that's a pretty interesting thing to think about. And then asked, how concerned are you about gender biases in healthcare? So majority of the responses were right at 3, about not really concerned, but not completely unconcerned about it. One person was not at all. 2 people at level 2. 2 people were very concerned about it. I then asked if they had personally experienced gender bias during a medical visit or interaction. 56.3% said no, they had not personally. One of those people did say that they had family members that had experienced it, however, they personally did not. And then 43.8% said yes. I then asked if you answered yes, if you were willing to share their experience. So here are some quotes from people from my survey talking about their issues. So the first one said, I spent 5+ years talking to my OB-GYN about having abnormal cycles to be told each and every time that what I was experiencing was completely normal. After multiple complaints year after year at my well woman visit and multiple less invasive options that failed to minimize my cycles, my provider finally agreed to a hysterectomy. After the procedure, pathology reported that I had adenomyosis. I had spent 5 years with a provider that tried to convince me that I was overreacting, but ended up having an actual diagnosis that explained my symptoms. I felt like my symptoms and complaints had been trivialized for multiple years, and I'd been put through multiple unnecessary treatments because the provider didn't take my complaints seriously. Another response said, I have a history of ovarian cysts, went to the ER for what I thought was appendicitis, terrible, awful pain. I couldn't walk, had all the tests done, told them about my history of cysts, and they told me it was constipation and sent me on my way. I didn't get any more pain meds to manage and had to take several days off to recover. Someone said health concerns were dismissed and told it was just normal female issues and hormones. Just a fact of growing older as a woman versus looking into whether other underlying reasons for issues. I think that personally is really sad that it is just a fact of growing older as a woman. That listening to all of these complaints and issues is just a fact that we are going to be underdiagnosed. And then again, I haven't experienced anything personally, but I've seen plenty of Instagram videos about new moms that were forced and unknowingly consented to procedures during birth that violated their preferences because the doctors know better. So this is also an issue that women maybe even don't even have autonomy of their medical care and different things like that. So this is a big issue, especially during the birth process as well, that women's healthcare experiences these biases. And these are my sources. Thank you for listening.